Мисля, че сме почти всички или всички, които се записахме и се интересуваме от събитието днес, можем съвсем спокойно да започнем. Всъщност, благодаря за това, че всъщност на този слънчев приятен ден, след обяд при нас, избрахте да се присъедините към събитието, на което ще представим статията "Подкрепа не само за физическото, но и за умственото израстване на децата. Ето как", което е част, всъщност, статия публикувана в списанието Early Childhood Matters на Фондация Бернард в Лейр. Казвам се Лора Лалова, програмен координатор в Тръст социална алтернатива, и заедно с моята колега Дена Попова сме виртуални домакини от името на Тръста на днешното първо събитие. Няколко технически думи, може би, преди да се впуснем в съдържанието на разговора. Разбрахте за записа. Ако някой не се чувства твърде комфортно с запис на събитието, може просто да изключи камерата. Идеята ни, разбира се, е да имаме, да можем да споделим записа от днешния вебинар с всички колеги, които по една или друга причина не успяха да се включат. По-голямата част от представенията ще бъдат на английски език, тъй като имаме наистина голямото удоволствие тримата автори на нашата статия да са с нас днес, и всъщност ще дадем думата на тях, за да разкажат малко повече от къде тръгват и всъщност как са стигнали до това, което ние днес разглеждаме като статия в списанието. Превод е осигурен. Малко всъщност долу в лентата с икони има една, която наподобява глобус, и когато всъщност отидете на нея, реално може да изберете езика, български съответно, ако е необходим превод от английски. Вече всички сме участвали толкова често и толкова много в онлайн събития, така че някои етикета, някои неща, предполагам, вече са доста познати. Когато текат представенията, ще помоля да изключим микрофоните, за да няма ехо и да се чува добре. Но всъщност чат функцията остава абсолютно отворена, така че каквито и въпроси и коментари да възникват, съвсем спокойно можем да ползваме чата за тази цел. С което, мисля, ако няма технически въпроси от ваша страна, можем да започнем съдържателната част на вебинара. И бих искала да дам думата на госпожа Сара Пери, изпълнителен директор на Тръст социална алтернатива.
Thanks, Laura. I'm going to go ahead and speak in English today since it's an English event, so I hope everybody has your translation on. First of all, I just wanted to say thank you to all the participants in today's webinar, and especially the authors of this important article that we're going to discuss today. It's an honor to have you with us. A few words as we start about who we are and why we're so excited about this initiative. I'm the CEO of a Bulgarian grant-making NGO called the Trust for Social Achievement, or TSA. We were established in July 2012 with the strong support of the America for Bulgaria Foundation. Since that time, we've worked hard to diversify our partnerships and have gained support from generous donors across the globe, including the International Step-by-Step Association. TSA was founded on the belief that society can only fully succeed when we ensure that all members have the chance to make the most of their individual talents. We work to create opportunities for disadvantaged groups with a focus on the Roma, 72% of whom live below the poverty line. We know that a holistic approach is needed and that it's necessary to tackle obstacles to development at each stage of an individual's growth, starting with safe and secure housing, working with parents to promote responsive care and a healthy start for infants, ensuring access to quality learning and care in the early years, supporting programs that promote excellence in education, and ultimately working to create pathways for a successful transition to the labor market. Since our very first days, we have recognized that early childhood development is a critical piece of the puzzle. Within our first months, we had already traveled to the United States to observe the Nurse Family Partnership Program, which is a home visiting program that matches nurses and midwives with first-time teenage pregnant mothers. We successfully launched this program in 2 locations in Bulgaria, in Sofia and in Plovdiv, and we are advocating for increased national support for home visiting and access to prenatal care. The first 1,000 days of a child's life give us a unique opportunity to create a strong start for their future success. We also know that early learning provides an important springboard for later educational achievement. This is why when we first started our work in 2012, we also identified kindergarten participation as a critical issue. At that time, only 42% of Roma children were enrolled in kindergarten. This is why we partnered with the World Bank and JPEL Poverty Action Lab to explore how best to increase Roma participation in kindergarten for children aged 3 to 6. They conducted a randomized control trial, an RCT, and this evaluation demonstrated that removal of kindergarten fees would significantly increase Roma participation, halving, in fact, the share of unenrolled children. With this in mind, we've been advocating with our partners for removal of kindergarten fees in Bulgaria. I think it's also of interest that we recently supported a nationally representative survey in 2019, and this showed that the share of Roma university graduates is 2 times higher among those who have attended kindergarten. Kindergarten attendance was also strongly correlated to increased high school graduation and higher employment rates. So this is why we were thrilled when Bulgaria's National Assembly passed a state budget act in December 2019 that included an allocation to cover full-day kindergarten fees for children from disadvantaged families. This policy intends to impact about 40% of all children in Bulgaria. That's close to 90,000 children each year. Of course, having made headway with regards to access, we are increasingly focusing on the aspect of quality of care, quality of learning provided by kindergartens and also in the home. One thing has become increasingly clear throughout the years, and that's the need for evidence and research demonstrating the long-term impact of these very early investments. This type of information has really proven critical for policymakers and also for the donors that support our work. This is why we're so happy to be able to have this discussion today, examining new evidence in the field of early childhood development. I'm so glad that you're participating in this webinar with us today, and I'm looking forward to learning more. So thank you all once again for joining us.
Благодаря ти, Сара. В продължение на, всъщност, по-скоро като въведение в това, което ще чуем и днес и утре сутринта, не си искаше да споделим няколко историята и няколко първоначални думи за списанието Early Childhood Matters, просто за да разберем малко повече за контекста, в който се случва днешното събитие. Историята му всъщност ни връща в по-далечната 71 година на миналия век, когато Фондация Бернард Лейр започва да издава бюлетин с новини и информация от партньори и всъщност членове на фондацията. В следващите години става ясно, че списанието, т.е. бюлетина като ресурс, става доста по-ценен и то за по-широка публика, не само за тесния кръг на партньори на фондацията. Така реално през 1998 година списанието получава облика, който всъщност имаме и днес. Основната роля на списанието е да поставя ключови въпроси, да разпространява всъщност добри практики или вече обещаващи решения, които са в подкрепа на цялостното детско развитие. Списанието, ще сложим линк всъщност към Early Childhood Matters, предлага всъщност един доста широк избор от различни статии, резултати от научни изследвания, успешни модели на работа от цял свят. И с това си съдържание всъщност има за цел и да вдъхнови експертите да прилагаме вече работещи програми и интервенции, които са в подкрепа на детското развитие. За втора поредна година Бернард ван Лейр и Международна асоциация Стъпка, поставя работят в сътрудничество и организират рамката, която ни позволи днес заедно с Фондация за нашите деца и Фондация за децата в риск по света да представим на българските експерти в нашия контекст, да представим 3 отделни статии от списанието, като на нас се пада днес честта да започнем с първата статия. Изборът ни, разбира се спря точно на тази статия, подкрепа не само за физическото, но и за умственото израстване на децата, защото до голяма степен, да не кажа напълно, заключенията в статията отразяват и философията на работа на нашата организация. И както и всъщност споменахме в началото, имаме възможността да поговорим и с самите автори. Това е от мен. Само, че трябва.
Чувате ме, нали? Да. Тъй като за нас до някъде за първи път се гмуркаме в подобен формат на вебинар, в който имаме гости, които всъщност ще представят самите автори на статията. Също така има представители от специалисти, които работят в сферата на ранното детско развитие, а също така има и родители. И всъщност не си иска да хванеме това разнообразие на всички, които сме се събрали. И за това ще пуснем една кратка анкета тук, буквално за 60 секунди. Лора споделя в момента линка. Отворете го и вътре това, което нас ни интересува е всъщност да разберем откъде сте и също така с какво се занимавате, каква е вашата позиция. Разбира се, да, в тези 60 секунди няма да сме толкова стрикни, но ако имате наистина и какво да споделите като ваш опит в сферата на ранното детско развитие, или пък ако сте родител, да отбележите, че сте родител. И също така, тъй като това е първото от поредица събития и в следващите месеци ще споделяме заедно с нашите партньори от За нашите деца и Фондация Децата в риск по света още материали, така че ако искате да останем т.е. да имаме контакт, след малко ще ви попитаме и за вашия имейл контакт. Така, може би мина вече минута. Бора може да спомня втория линк, който пък е за вписване на имейла.
Всъщност това, което ще направя е да споделя накратко моя всъщност десктоп, за да видите резултатите. За мен е показателно. Нали виждате какво се случва в момента? За мен е показателно много интересно. В София сме, България, от Пловдив, но има интересни отговори, като от работното място. Така. Но по-интересното е, всъщност имаме психолог, всъщност повече психолози, координатори по-скоро, ръководител на екип, икономист, ръководител проекти, служител в неправителствена организация. Предположението ми е, че след като сме се включили в този вебинар, на практика всичките работим по един или друг начин в сферата на ранно детско развитие. Добре. Мисля, че няма повече, не се генерират повече отговори, така че благодаря ви за експеримента, да видим кой откъде е и с какво се занимава. Ще споделя, както каза Дена, ще оставя всъщност отворен линк, на който можете да впишете имейл адреса си за контакт. Знаете реално, че можете да ни намерите и в Facebook, имейла на Тръста. Но за всеки случай оставам и втори линк, където може да запишете имейл адрес. Така. И всъщност, докато работехме по самата статия и организирането на събитието днес, така с колегите решихме, че ще е много приятно и доста така лесно да представим самата статия визуално, чрез едно кратко видео, историята на Ани, което се получи доста добре и ми се струва, надявам се да се съгласите с мен, че е хванало основните послания на статията. Затова предлагаме, преди да дадем думата на нашите автори, всъщност да изгледаме и краткото видео.
Това е Ани. Майката на Ани разказва
Дали да не го рестартираме?
Добре. Само секунда. Трябва да ми извините, но технологията понякога отказва. Сега би трябвало да се вижда и при вас. Надявам се и да се чува.
Това е Ани. Майката на Ани разказва история всяка вечер преди да заспи.
Да.
Голямата й сестра пее песни и играе с нея активни игри. Тя и по-големият ти брат играят стопка. А бащата на Ани и прави количка от тел и играят заедно. Тези на пръв поглед елементарни дейности създават богата и разнообразна среда, която развива мозъка на Ани. Как знаем това? Научни анализи показват, че отзивчивите грижи ускоряват развитието на мозъка на бебетата, а това води до повишаване на техните умения. Над 70 години учени наблюдават това при животните. Те сравняват структурата на мозъка на гризачи, които растат в изолирани и празни пространства, спрямо такива, които живеят сред други представители на вида си и в разнообразна среда от цветни предмети. Животните, отгледани в богата среда, имат по-голям мозък и повече синапси на невроните в сравнение с тези, които са отгледани в изолация. А това е предпоставка за формиране на повече връзки между мозъчните клетки, съответно за по-добро умствено развитие. Какво означава това за детския мозък? При децата може да се измерят уменията за учене, развитие на говора, емоциите и движението. За целта учени правят анализ на 75 програми за ранна интервенция при бременни жени или деца до 5 годишна възраст. Оказва се, че повечето от тези програми са хранителни и се фокусират върху превенция на забавянето в растежа, вместо да насърчават отзивчиви грижи и възможности за учене. Но изследователите не намират доказателства, че подобрен физически растеж съответства на подобрение в развитието на мозъка. Така, ефектите от тези хранителни програми са 5 пъти по-малки от ефектите на програмите за отзивчиви грижи. Все пак, 14 от анализираните програми стимулират отзивчивите грижи и възможностите за учене чрез пеене, рисуване и други дейности. Децата в тях показват по-високи когнитивни, езикови и двигателни резултати с общо над 18 IQ точки в сравнение с останалите деца. При някои от програмите за отзивчива грижа и учене, ефектът в развитието е впечатляващ дори години по-късно. Какви са изводите? Адекватното хранене е важно за развиващия се мозък, но не е достатъчно. Обикновените дейности, които родители или полагащи грижи лица могат да правят с децата, имат трайно положително влияние върху формирането на детския мозък. Затова са нужни всеобхватни програми както за хранене и превенция на забавяне в растежа, така и за отзивчиви грижи и възможности за ранно учене. Чрез инвестиции в тази посока децата ще могат не само да израстват физически, но и да реализират пълния си потенциал за умствено развитие. А ние ще се радваме на процъфтяващо в интелектуално отношение общество.
Това беше видеото. Имахме късмет и спокойствие да го изгледаме. И всъщност наистина едно прекрасно въведение и представяне на същността на статията, за която сме се събрали. И сега всъщност ще се гмурнем в самия разговор и дискусия с авторите. Много накратко ще споделя кои са авторите всъщност и ще ви ги представя. Доктор Елизабет Прадо е асистент в катедра по хранене и в Института за глобално хранене към Университета на Калифорния в Дейвис в САЩ. Тук също е и доктор Лейла Ларсон, която е асистент в катедра за насърчаване на здравето, образованието и поведението към Университета на Южна Каролина, Колумбия в САЩ. И също така господин Анурадж Шанкар, който е главен учен в Ейкман, Оксфорд, в звеното за клинични изследвания към Института Ейкман за молекулярна биология в Джакарта, Индонезия, и също така главен учен в Центъра по тропическа медицина и глобално здраве, катедра по медицина, Нюфилд, Университета Оксфорд. И всъщност изключително се радваме, че успяхме да ви съберем тук, за да разкажете за вашата работа, също и за самата статия. И може би всъщност да започваме с презентацията, която знаем, че сте подготвили, а след това ще имаме време за дискусия и за въпроси.
Okay, should I go ahead and get started?
Да. Yes.
Okay. Yeah, I understand that much. Okay, so let me share my screen. Okay, so I was not able to understand the video, but I think that probably you all have just heard most of what I'm about to say, but hopefully be able to shed some more light on our study and what we found and what the implications are. So millions of children across the globe are experiencing stunted growth, which is not growing in height the way that they should for their age. So the child who is stunted may not look malnourished, like a child who is wasted or underweight, but they're short for their age. So if you had to guess which of these two children is malnourished, you might not guess that it's actually the child on the right. You would have to plot their height for their age to know that the child on the right is much older and is very short for her age. So we know that this linear growth faltering occurs during pregnancy and the first 2 years after birth. So in this figure, 0 would be a population that is on average for healthy growth. So in a population that is growing normally, they would track right along at 0, which is an average height for age in a healthy population. But you can see that in many countries, linear growth faltering, it starts before birth and then it continues through about age 2 years and then levels off. So this early period is also a very rapid period for brain development. And stunted growth is associated with poor cognitive development in both the short and the long term. The Nurturing Care Framework was published in the 3rd Lancet series on early child development, and it was launched by the World Health Assembly in 2018. The framework identifies 5 essential factors to promote human capital development from preconception through 3 years of age. Children need environments that are stable, that promote good health and adequate nutrition, that provide security and safety, so protection from threats, and ensure opportunities for learning and responsive caregiving, which is relationships that are emotionally supportive and responsive to children's needs. Many early childhood programs across the globe focus on just 1 or 2 aspects of nurturing care, improving children's nutrition and health to try to reduce stunted growth, often with the assumption that children's cognitive development will then be improved. So one of the reasons that we started this research was to really test this assumption. Is this really the case that we can assume that programs and interventions that improve children's growth will also lead to improvements in cognitive development, language development, motor development, and social emotional development? So our first objective was to determine whether, as I just said, whether this assumption is true. Do early childhood interventions with greater effects on linear growth also have greater effects on developmental outcomes? So we looked across all different early childhood interventions and we wanted to see, do these effects correspond to each other? Our second objective was to identify the pooled effect size of different types of interventions on outcomes among all published early life interventions that measured both length for age z-score or height for age z-score, so that standardized measure of linear growth, and also developmental outcomes. So through this analysis, we identified the types of interventions that have a greater effect on linear growth than on development, and vice versa, and the types of interventions that have a similar effect on both outcomes. And I'm just pausing a little bit because I'm not sure how long it takes to translate what I'm saying, so I'll just pause occasionally in case the translator needs to catch up. So we had a set of inclusion criteria. We only included randomized controlled trials. The participants had to be enrolled during pregnancy or 0 to 5 years of age. And they had to report effects on length for age z-score or height for age z-score, and at least one developmental outcome of interest. So cognitive, language, motor, or social emotional development. But the outcomes could have been measured at any age. The intervention had to be delivered during pregnancy or up to 5 years, but we included studies that measured outcomes at any age. So we included 75 studies. Here you can see that we screened more than 7,000 studies that were identified through our literature search. And after applying our inclusion criteria, we included 75 studies. And I saw 75 in that video, so I think that must have been referring to this. Of the 75 studies, 61 were conducted in low or middle income countries and 14 in high income countries. 14 interventions were provided to pregnant and or postpartum women, 52 to children, and 9 to both. So 9 enrolled pregnant women and then provided an intervention during pregnancy and then continued providing an intervention also to the child. The 75 studies reported 122 contrasts between intervention and control groups. So some studies had multiple intervention groups compared to the same control group. So the total number of intervention versus control group comparisons was 122. 50 studies provided nutritional supplements, and 14 studies promoted responsive care and learning opportunities. These were the only 2 categories of interventions that were provided by 5 or more studies. So we only analyzed pooled effect sizes in these 2 categories of interventions. So this meta-analysis was different than a typical systematic review and meta-analysis because we did not restrict our inclusion criteria based on the type of intervention. We only restricted our inclusion criteria based on the outcomes reported by the studies. So that's why we had all of these different types of interventions for studies that met our inclusion criteria, but we were only able to analyze pooled effect sizes in 2 categories of interventions: nutritional supplements and responsive care and learning opportunities. Other studies provided WASH interventions, nutrition education, cash transfer, and there were 7 other types of interventions. This map shows the places where the studies were conducted. So the darker colors are where fewer studies were conducted. 1, 2, or 3 studies is in the purple or the blue. And then the lighter green is where the most studies were conducted. So the most studies were actually conducted in Bangladesh, 13 studies. But you can see we did have studies from all of the continents: North and South America, Africa, Europe, and Asia. These figures may be small depending on how large your screen is, but these are the figures that we published in the paper to summarize the studies that we reviewed. So the intervention, this panel shows the prenatal and postnatal maternal interventions. So the gold color shows when the intervention took place. So you can see all of these studies enrolled pregnant women. So they started in utero, and they continued up to even 18 to 24 months postpartum. And the vertical lines show the time point when the outcomes were measured. So some of the studies provided an intervention in utero, but then didn't measure the outcomes until 12 months or 36 months, or even out to 12 years after the intervention was conducted. So these icons show the outcomes that were measured: height or length for age or height for age Z-score, cognitive development, language development, social emotional development, and motor development. And the gray shows no significant effect. The yellow shows a significant positive effect, and the red is a significant negative effect on that outcome. So some studies also had 2 time points. So if there was a end-line time point and then a subsequent time point, we also did a secondary analysis of follow-up studies, but there were not very many of these, so we weren't able to draw many conclusions. So here you can see the different types of interventions that were provided during pregnancy. We have different types of nutritional supplements, multiple micronutrients, iron, choline, zinc, iodine, fortified milk. We also have breastfeeding promotion, nutrition education and health. This is antimalarials and erythromycin during pregnancy. This one varied the timing of delivery by C-section. So this was one of the studies in Europe. It was done in 5 different European countries. We had a couple of WASH interventions and a cash transfer. So here you can see where positive effects were found in which types of interventions. This shows the postnatal child micronutrient plus macronutrient interventions. So it could have been amino acids or fatty acids, fortified milk, lipid-based nutrient supplements. And these were all provided to children, either at birth or during the first few years after birth. And here again, you can see the different countries where they were done and where positive effects were found. This is the postnatal child micronutrient interventions. So these studies provided multiple micronutrients, zinc, iron, iodine, vitamin D, and this was a reduced phytate porridge. So again, you can see there are different timings of these interventions, different timings of the outcomes, and here you can see where positive effects were found. And finally, the postnatal interventions that promoted responsive care and learning opportunities, and then a few other types of interventions. So we had studies that provided responsive care and learning opportunities plus nutrition education. A lot of studies combine those together. There are a few studies that also provided nutritional supplements with the responsive care intervention. We had some vaccine and antibiotic trials, foster care, cash transfer, and WASH were a couple of the other types of interventions. So here you can already see that there's a lot more yellow, right? So we can already see before we even do our statistical meta-analysis, we can just visually see from what these studies reported that we're finding many more positive effects in these studies that are providing responsive care as compared to the studies that only focused on nutrition and health. And even here you can see some positive effects in the follow-up studies. So our first question was really looking at this question of whether effects on linear growth correspond to effects on development. So to do this, we looked at a meta-regression, looking at the association between effect sizes on linear growth versus effect sizes on the developmental outcomes. So these figures show the effect sizes in each intervention. The orange line is 0. So at the orange line, this would mean if there was a blue square here at the orange line, this would mean that there's no difference between the intervention and control group in that comparison. A positive effect would be on the right side of the orange line, and a negative effect would be on the left side of the orange line. So these are arranged from the interventions that had the smallest effect on linear growth here at the bottom, all the way up to the interventions that had the largest effect on linear growth at the top. So if the assumption were correct that improving growth improves developmental outcomes, we would expect the same pattern in every figure, with the smallest effects at the bottom and the largest effects at the top. But you can see that that's not the pattern we observe. So we can really see here that it's not the case that an intervention that improves children's linear growth will necessarily improve their developmental scores or vice versa. We didn't see any association between effects of interventions on linear growth and effects on cognitive, language, or motor development. Programs that provided maternal and or child nutrition had small effects on growth and all developmental outcomes. So here you can see we had 20 to 50 studies that provided nutritional supplements across the 5 different outcomes. And across all of these outcomes, we had about effect sizes around 0.1 standard deviations. So that's about 1 or 1.5 IQ points. So this first line is all nutrition supplementation studies. And then we divided the nutrition supplementation studies by different categories. So we only had 6 studies that provided nutritional supplements in high-income countries, and we really didn't see effects in those studies. But in the low and middle income countries, we did see positive effects of nutritional supplementation. We also found positive effects of child supplementation, but not maternal supplementation during pregnancy. And we found positive effects of macro and micronutrients on growth and 3 of the developmental outcomes, language, motor, and social emotional. But we did not find effects of multiple micronutrients or single micronutrients on growth, but we did find effects of multiple micronutrients on developmental outcomes, which you can see here. But generally, all of the effects, no matter what type of nutritional program was provided, the effects are generally small. They're in the range of about 0.1 standard deviations or 1 to 1.5 IQ points. The really striking finding was these large effects of the responsive care and learning opportunities. So this is overall, and in low and middle income countries, we find effects that are about 0.4 to 0.5 standard deviations or 5 to 7 IQ points. So this is a new result. So this was not reported in the paper, but we have a new paper that we are currently writing where we've looked at some of the different characteristics of the study populations that are predicting effect sizes. So we found that among the nutrition programs, we find positive effects in East Asia and the Pacific on cognitive and motor development, in South Asia on all of the developmental outcomes, and in Sub-Saharan Africa on growth and all of the developmental outcomes. But we did not find positive effects of nutrition programs in Europe, Central Asia, Latin America, and the Caribbean, Middle East and North Africa, or North America. And this I also thought might be interesting for this group. So this is not from our research. This is from a paper that was written by Frances Aboud and Aisha Yousafzai. It was published in 2015. But they looked at, among responsive care and learning opportunities, what program techniques are more effective. So they found that factors that predicted larger effect sizes were in countries that had a higher human development index, when programs used small media, so posters, cards, or brochures, illustrating caregiving activities that were then given to the family at the home visit to remind the parents of the activities they were learning. Active practice of activities during the home visit. So instead of just delivering information, actually having the parents practice the activities that were being encouraged. Problem-solving techniques, so discussion about how to overcome barriers, maybe that the caregiver was facing, or other types of problem-solving techniques. And also use of more than 2 behavior change techniques. So if someone, typically the programs that used only 1 or 2 techniques were delivering information verbally, and maybe 1 other technique. But it was really the programs that used multiple techniques that led to larger effect sizes. And this was in 21 different interventions they analyzed. Factor that predicted smaller effect sizes was provision of materials such as toys and books. And the author speculated that that may have been because when the program provided materials, the family relied on those instead of trying to come up with ways to provide their own materials, like making homemade toys or other strategies that they could provide those things for themselves. A higher number of contact hours did not predict effect sizes in their analysis. So it didn't seem to matter, just the time on its own, the number of hours the program spent with the families did not predict larger effect sizes. And there was not enough evidence for promoting social support from family or peers. So this would be something like talking to the family about how they could support the mother, or having peer groups where the primary caregivers provide social support to each other. So not enough programs implemented this technique to be able to know whether it was effective. So conclusions from our research was that postnatal macro and micronutrient supplementation affects both linear growth and development. Multiple micronutrient supplements and responsive care and learning affect development, but not growth. So again, these two outcomes are not very closely tied with each other, as much as is often assumed. Effects of caregiving interventions on development are 4 to 5 times larger than effects of nutritional supplementation. So we can expect only small gains in child development through nutritional programming alone. Achieving thriving individuals and communities requires interventions targeting caregiving behavior and learning opportunities that support cognitive, language, motor, and social emotional skills. So the World Health Organization and UNICEF have developed a number of tools and resources that are available for program planners and managers, community health workers, workers in health facilities. The Reach Up and Learn curriculum is also a really great resource. It's freely available, and it's an evidence-based program that was developed in Jamaica and has been shown to have both short and long-term effects on children's development. And most country work is currently at the policy and planning stages with some pilot activities. So it was great to hear about what Bulgaria is doing. I think it's great that you all are advocating for these policy changes, and that's really far ahead of where many countries are. In many countries, the nurturing care messages are being added into sick child consultations, well child clinics, immunization days, growth monitoring, anti and postnatal care. So all of these health programs that were really established to address survival and communicable disease. So a big question is, are these really the appropriate platform to address child development and non-communicable diseases? And that's a question that really hasn't been answered yet. And another question is this really practical at scale? Are we just adding to the burden of already overstretched workers who are delivering these health interventions? And there's really not enough evidence for that yet. And monitoring and documentation is still pretty weak at the country level. So, I know you all are also aware of how important it is to have data and research to inform policy and convince policymakers. So this is another area that really needs to be strengthened. And there is a plan to add early child development indicators to the DHS and mixed surveys, so the demographic and health surveys, the UNICEF surveys. So hopefully that will help with monitoring, but we really need deeper data, which we can talk about more in the Q&A, to try to really understand more about how to implement these programs well on a large scale and maintain their effectiveness. So that's all I had. We had many data extractors work on this project. So thank you to all of them, and thank you.
Благодаря, Елизабет. Сега, всъщност, наистина благодаря за този толкова подробен и също така практически ориентиран поглед върху статията и работата, която сте свършили. Сега, всъщност, бих искала и към Елизабет, и към Анурадж, и към Лейла да се обърна. Разбира се, в един идеален свят политиките, които се създават, следва да бъдат наистина базирани на доказателства. Това се случва в някои контексти, в други контексти е по-сложно, но ми е интересно, вие вследствие на тази статия и вследствие на този толкова задълбочен метаанализ, наблюдавате ли някакви последици сред хора, които отговарят за, т.е. законотворци, политици, практици. Тоест, имате ли някакъв поглед върху живота на тази статия и метаанализа в реалността?
Anu or Layla, do you all want to say anything, or should I say something about that?
You go ahead first, and then I have a few follow-up comments.
Okay. Yeah, sorry. I did want to give Anu and Layla both a chance to just share their thoughts also, just in terms of the implications. But I'll answer this question first. So what has really influenced policy is the nurturing care framework. So with the launch of the nurturing care framework by the World Health Assembly, and then at the country level, many countries have then launched this sort of nurturing care framework by the president or maybe the first lady in some countries. So that is what it's been helpful for countries to sort of think about early child development in a more holistic way, instead of health in its silo and education in its silo, really looking at these 5 elements that are all essential for children's development and how to bring those together to make sure children receive all of them. So I think in terms of our paper, I'm not sure. I don't know actually if it's been influential in policy, but I know that the nurturing care framework has.
I'd just like to comment briefly. I agree with what Beth is saying about how really this nurturing and care framework, this paper has, I think, really helped to underscore that. And I would also like to add that, currently globally, there's a very big focus on stunting reduction, both throughout African countries and also throughout many of these Asian countries. And one of the reasons, of course, that they give for this is that they believe that increase in linear growth, making the population taller, will actually lead to some substantial benefits from the cognitive standpoint of these children. So this paper is really highlighting that, maybe that's not so true, that in fact, if you really want to create thriving populations and smarter people and adaptive individuals, competitive in the world for themselves and their families and their nations, you really have to focus on, with intent, these early childhood development programs, nurturing and stimulation. And in fact, not just early childhood, but in fact, throughout the life cycle. This is extremely important. And so here in Indonesia, for instance, there's a very large national stunting reduction program just being launched. This paper has been, in fact, shared with several of the policymakers and has made them, pause a little bit and to think, okay, we still want to do the stunting reduction, but let's integrate with that, think about how we can do more on the nurturing and stimulation part. So I think that it's very important that, all scientists look at this evidence and really try to focus on what's necessary, to create these thriving populations, wherever they are, cite the evidence, this evidence and other evidence to help shape that policy change. And I think that policymakers are open to this. Yeah. So that'd be my opinion about it. Yeah. Thank you.
Yeah, and I'll just drive home the point that while we know that nutrition interventions are very important and beneficial for, health outcomes in children, stunting, anemia, other nutritional deficiencies, and just the diet in general of children, if our goal is to improve early child development, it's really these responsive parenting, these early learning programs that are having the biggest bang for our money. We're seeing effects that are 4 to 5 times larger from those types of interventions than the nutrition interventions. That said, I think they can easily be combined through things like nutrition and parenting interventions can be combined through things like responsive feeding, where, a mother can interact with her child while feeding her child. She can sing to them, rhyme to them, sort of be responsive to them. And then you're kind of targeting both nutrition and psychosocial stimulation at once.
Благодаря. Сега, всъщност, сигурна съм, че може би сега е момента да отворим дискусията към всички участници. Може да задавате въпроси или пък да пишете въпросите си в чата. И докато поеме своя път дискусията, наистина иска ни се възможно най-неформално, каквото ви идва в момента на ум, да задавате, свързано с статията. Аз имам един следващ въпрос, който всъщност е какво се случва, какво е влиянието върху всъщност ранното детско развитие и изобщо какво се случва в контекста на COVID през последната година. Забелязвате ли някакви притеснителни тенденции? Или може би пък примери за справяне с трудната ситуация? Този въпрос всъщност насочен към всички, но преди всичко към вас, тримата автори. Разбира се, ако някой друг... Да.
I mean, I might start. I'm not sure I can answer the question of how parents are coping necessarily, but I think I might just sort of emphasize the point that we're seeing a lot of increased parental stress. We're seeing a lot of increased parental anxiety, effects on mental health of not just the parents, obviously the parents, but also the children, both, and in different ways. And I think that's sort of an important reflection to make, and perhaps something that could be addressed in parenting programs now and also in the future when this pandemic is over. Actually, there was a recent review that was published by FHI 360 and the LEGO Foundation, I think, and they were kind of looking at some studies that have been published over the past year, exactly sort of looking at that, you know, what's the influence of COVID on parenting programs, and that's sort of what they found. There's increased anxiety. Fathers are being more involved in childcare, but mothers are still disproportionately, you know, have that responsibility. And there's effects on physical activity of children. You know, children are not engaging in physical activity as much because they're not in school, or necessarily just able to like interact with other children. So there's a lot of these effects. And I guess the policy implications for that are really around prioritizing parental stress and anxiety, and also mental health services for both the parents and the children.
I have a question if we're opening it up.
Да.
I think, Anu, did you want to say something else about COVID? I know you're doing some work in
Yeah, I mean, we're just
Indonesia.
work on COVID-19 here in Indonesia and the impact of this. And, you know, certainly there have been several articles written about what's referred to as the lost generation, you know, children due to impact of COVID-19, both direct and indirect effects. Issues, of course, where, you know, one of the parents may have died, you know, from COVID-19, but also, as Layla mentioned, you know, the schools being closed and kids not being able to obtain as effective education, some people having access to online education, but this has very much affected the education of kids, and also the amount of time actually parents are able to spend in a really constructive way with their children. It seems sort of counterintuitive because people are home and together, but I think the various different stresses of how to cope with the situation, especially how to deal with things economically, has really created substantial changes. I think there are some studies now starting to come out about really, how this is affecting much more child's cognitive development, and I think we'll be seeing a lot more on that. So separately from that, I would like to share that we have done quite a bit of work here in Indonesia now tracking antenatal care. So, care of the mother during pregnancy and how this is affecting progression of pregnancy. What we're finding is that there is certainly still first antenatal care visits occurring and the last antenatal care visit closer to delivery. But these other visits in between, where they might be picking up complications of pregnancy as it progresses, those are really not being done. There's a substantial reduction in those, an overall reduction of around 50% in number of antenatal care visits being done. So this is for sure a very substantial impact. It's already been shown that there's a direct impact of COVID-19 on pregnancy outcomes due to illness during a pregnancy. But separate from that is this indirect effect of the care. And for sure, this is affecting child brain development as well. Remains to be fully quantified. So I think, this impact of this lost generation is very important, both the direct and indirect effects. And what's necessary, I think, really is to embrace this idea that, we do need to focus on certain specific things to maintain the resilience of this ability to provide nurturing and stimulation and childcare. So direct programs to reach out during this period, a hotline, and also specific types of programs where you're calling households or being able to provide assistance, specific ideas, some of the same sort of things you've already been exploring with the programs you've been implementing there in Bulgaria. So I think finding a solution for this and implementing it is very important.
Благодаря. Сара, ти имаш ли въпрос?
Sure, I'll go ahead and ask it. And I see there's one in the chat section too, but I'll ask it quickly. Just to make sure that I think I understand and everybody in the audience understood the presentation. From what I understood, it sounded like nutrition in general, the nutrition programs helped, but didn't help as much as the responsive care programs. First, could you confirm if that's true? Because of course, we've had a lot of focus on nutrition in Bulgaria, and I think it will be interesting for people to know if that was the wrong direction or the right direction. But from what I understood, it sounds like it's helpful, but it's not as helpful as combining nutrition, for example, with responsive caregiving. And are there any examples where nutrition programs were harmful? And could you talk about what those programs were? Thanks.
Yeah, so you're absolutely correct. So the pooled effects of nutrition, pretty much regardless of what type of nutritional program was provided, were about 0.1 effect size, which is about one or 1.5 IQ points. So nutrition programs have positive effects, but they're small in size, whereas the responsive care and learning opportunities programs improved children's IQ by 5 to 7 points. So 5 times larger effects of the responsive care interventions. And in terms of the negative effects of nutrition, yes. So if you look at those figures I showed, there were a couple of red, red icons that showed negative effects, but they're sparse. And I haven't gone back and looked at why. I'm sure in those papers the authors would have made some interpretation of why those effects were negative. And I don't remember right now what those authors said about that, but that would be something interesting to look into. Like, why would there be negative effects? It's not clear.
Yeah, let me just jump off of that and say, yes, there were a couple trials of nutrition interventions. They were both in pregnancy when micronutrients were given to pregnant women, and some small negative effects were found in either growth or child development in the children later in life. And I think what's important here is with nutrition interventions, particularly with supplementation trials, it's very, very important to understand the context that you're working in. What is the baseline status of the population? Is, are these pregnant women actually deficient in the micronutrient that you're about to supplement them with? So is there a potential to benefit from the nutrition intervention? And then particularly with something like iron supplementation, which was one of them, there are potential negative effects if you give too much iron to somebody. And I think that's why it's so important to make sure that if you're going to give something like iron, making sure that the population is actually iron deficient to begin with. Yeah. And then I just also wanted to emphasize the point that while we didn't see huge effects from nutrition interventions, I don't want to discount them. I think that the point is that these more integrated approaches that combine things like nutrition, psychosocial stimulation, those are very important and they go very well together. So I don't want the conclusion to be that we should only focus on psychosocial stimulation and forget about nutrition. That's not the conclusion that I'm hoping people take from this. I think the conclusion should be that we need to be more integrated in our approaches because children face different forms of adversity in their environment. They face, potentially undernutrition. They face lack of psychosocial stimulation. In a lot of resource limited settings, they face high frequency and severity of illnesses. And so addressing these factors in a comprehensive way, that's the most sustainable way to see really important benefits on early childhood development.
Yes, I agree. And if you think about caregiving, any kind of caregiving intervention where you're doing a parenting group or you're doing a home visit, talking to caregivers of young children, so much of a caregiver's time is devoted to providing food for their child. So it's a very natural integration when you're talking about caregiving to be talking about nutrition. So yeah, I totally agree with Layla that these work very well together and both are very important.
Това е много добър преход към следващия въпрос, който всъщност намираме в чата от Трендафи Омерете. На базата на този забележителен брой интервенции, с които сте се запознали, но и също така имайки предвид интервенции във вашите държави САЩ и Индонезия, има ли... Всъщност, чакайте, защото се опитвам да направя комбинация между мой и въпрос на Трендафил, но всъщност в САЩ и в Индонезия страни, в които се прилагат т.е. имате ли пример за интервенции, които прилагат този интегриран холистичен подход, добри практики, които може да споделите с нас? И също така конкретни резултати, които се наблюдават от тези добри практики.
Yeah, I would like to say a lot of these programs related to trying to integrate, this nutrition with early childhood development, nurturing and stimulation programs. These are just beginning. There's two things I wanted to share in that context. So one is that in another systematic review that I've done with colleagues, including Aisha Yousafzai, basically looking at how nutrition program implementation is similar or different from nurturing and stimulation program implementation. And what we observed in that, it was in fact the nurturing and stimulation programs are typically more complex, involving more skilled personnel. And nutrition programs tend to focus on more sort of simpler approaches and not being as engaging with the clients. And so I think that the lesson from that is that you need, it probably as one integrates nurturing and stimulation with nutrition programs, to be very careful that you're actually adding a nutrition program to a nurturing and stimulation program, not the other way around, because you might end up with a much lower quality nurturing and stimulation program that's not going to be effective. So in terms of combining these things, I think that's something that is very important to think about. Now, there have been actually some interesting programs where they've integrated nutrition and nurturing stimulation. I think, I think Beth and Layla, you may know more about, you may recall this older study, the original one's from Jamaica, where I think they did include some food-based supplementation along with that. And there was a more recent one, I believe, in Colombia. I don't remember the name of that, but that was also published not too long ago, where they showed certainly combined effects of both the food-based supplementation and the nurturing and stimulation. But again, very similar observation that the effects of nutrition on growth were not as great as would be expected. So to me, I think that, yeah, it's a good idea to, I would put the big focus on, the scaling up of nurturing and stimulation. And I just want to highlight one thing that is really a fascinating observation and that we need to deal with, which is that there are very few, if any, policies at the national or global level focusing on any psychosocial intervention delivery at scale on a routine basis. So we may have vaccine programs, we may have antenatal care programs, we may have, antibiotics treatment for pneumonia and such, but in fact, actually mandated programs where social intervention programs for nurturing and stimulation, programs to prevent depression in pregnancy or postpartum depression and the impacts that have on the child. All these psychosocial interventions, there's very few actual policies mandating that type of intervention. And one reason for this is that there have typically been very few, if any, large-scale randomized controlled trials of any psychosocial intervention at all. And so this is because of the misunderstanding of what humans actually are, where we somehow classify human beings as primarily biomedical entities, where in fact we are all predominantly psychosocial entities. So I think this is the time in history of humanity for us to launch, in fact, public health social science. And I hope in Bulgaria, you can be a leader in this, where you can create this new field, which is essentially public health social science, and creating interventions, doing these large-scale trials, showing that they have an effect, and hopefully getting to global policy where such important social interventions are mandated. And then we can include nutrition along that also. But the gap is these psychosocial interventions, including nurturing and stimulation.
Да, наистина. Това е нещо доста необходимо, което да бъде предприето. Имаме още два въпроса в чата, затова ще побързам да ги споделя с вас. Първият е от Валентина Стоева, която благодари за полезната статия и също така въпросът е: може ли да споделите дали програмите, в които е застъпено четенето от родителите на децата, като част от отзивчивите грижи, отчитат по-високи резултати? Забелязва ли се нещо по-специфично като резултати вследствие на четенето?
Layla, can you answer that? I'm not sure about that.
We actually didn't pull out that specific information in our paper. However, I'm going to rack my brain from way back when, but I have read some papers on that saying that the amount of words a child receives, so whether it be reading or speaking, the amount of language that the child is exposed to matters a lot in early life. So in that respect, that it is very important. So again, whether it be reading or just kind of talking to your child, that is very, very important.
So this sort of goes along with Anu's point that, very few large-scale randomized trials have looked at effectiveness of these types of programs. And what needs to be done is that kind of robust research design and also very detailed documentation of what is actually implemented, because that will move us forward to answer that kind of a question. So not just, saying, here's our group that got the intervention, here's our group that didn't, and looking at the effects at the end, but actually tracking what happened in each home visit. What did they actually do? How did what did the caregiver come away with? How did behavior change? And with mobile, technology and electronic data collection and devices, there's great potential to do that kind of research in this day, but it hasn't happened yet. But that kind of a research question could be answered with that kind of a trial where you can even have an app, right, that has children's books. So if you deliver this app that has children's books to a group, and then you can track how often do they open it. There's all this back-end data that actually could show you which books did they read, how often, what was the duration. You can get that kind of information now that could really help us understand what are the ingredients, the specific aspects of the programs that are making a difference. And I think that really needs to be done. And Anu and Layla and I have talked about that, and we hopefully will get it together to apply for some funding to do that kind of a project at some point soon.
Утре, между другото, ще имаме възможността да чуем презентации за някои добри практики от България, и Валентина Стоева ще представи точно темата за четенето в тази най-ранна детска възраст. Следващия въпрос. В изследването в този метаанализ попаднахте ли на програми, които са свързани с домашни посещения, патронажна грижа, и забелязахте ли някакви, какъв ефект забелязвате при тези патронажни услуги, домашни посещения?
So the programs that we reviewed in our paper, many of them provided home visits, and there were also some that provided parenting group sessions. So the effect sizes that I showed you that were about 5 to 7 IQ point increase in the children were from a combination of home visiting programs and parenting groups, but providing the same kinds of responsive care and learning behavior change intervention. And I think most of them, I know we have that information. I can't remember how many of the 14 provided home visits, but I think most of them did. Do you remember, Layla?
I don't remember exactly, but I do want to address this point because this is a really good one. So I think there's sort of 3 typical modes of delivery, either home visits where it's one-on-one, clinic visits, or group visits, where groups of mothers get together. Doesn't matter what age the child is, and then they talk through different activities and go through a curriculum together. There is recent evidence that actually studied the difference between all those modes of delivery and actually found that it was the group sessions that had the largest effects. And I think that's because women in group sessions, mothers get much more social support from each other rather than just support from one individual, sort of the volunteer that comes and goes through the curriculum with them. And I think that's a really important piece. So in group sessions, they're shown an activity for that day, they practice that activity, and they get feedback from the person leading the session, but also from other mothers. And I think that's a really important piece. And just, from my own experience, mothers groups have been incredibly helpful to myself, not just because of the person giving me the information, who's charged with giving me that information, but the experience of other mothers around me and the support that they give each other. So they did see larger beneficial effects from the group sessions rather than just individual home visits.
Благодаря. И последния въпрос, като предполагам, че може да имаме време и за още един последен, но последния въпрос е от Анчи Кривонозова, която пита какъв е ефекта върху децата, когато се включат в образователната система като ученици. И тук може би аз бих допълнила какво се случва наистина, когато едно дете, започнало своите първи години в стимулираща среда, се сблъска с някаква по-лимитираща образователна система, да кажем.
Yeah, there is research that has shown loss from early gains. So if a child is in a positive early environment, but then goes into a school that is not a high quality school environment, then those early gains can be lost. So it is really important to sustain, keep a sustained positive learning environment throughout childhood to try to prevent that from happening. Yeah, I don't know if Leyla or Anu wants to say anything else about that.
Yeah, just that, I completely agree. Those things have been found both, in intervention trials, right, where they observe some effect early on, and then the fidelity of the delivery of the intervention was less and those gains were lost. And likewise, you're going to a school that maybe is not as good, but so again, being able to maintain that environment as much as possible in the household, in the community, having communities that are committed to education. Many of you may be aware of the amazing story in Brazil related to education in a town called Sobral, S-O-B-R-A-L. And in Sobral, about 25, 30 years ago, the town made a huge commitment to education. And within a relatively short amount of time, in fact, they started producing some of the kids scoring the highest on the national Brazil academic exams. And it was really a community commitment to child development and elementary education that made that change. So such things are certainly possible to do. That's a great story if you want to look at that. But the other thing I just did want to focus on is that it's true you can lose these gains, but don't forget every moment in life, throughout your life, is a great time to start learning something new. And so whatever gaps there may have been that you may have experienced, it's never too late to help a child get back on track and to learn, or to help another adult get back on track and to learn. So that's very important, because I fear sometimes people talk about these certain golden periods in a child's life, which are very important periods. But even though they've gone through that period and not experienced optimal care, it's amazing what kids can achieve once they enter a positive environment. So I think the real lesson in all of this is to focus along the whole continuum, and say throughout life, we need to be focusing on nurturing and stimulation for individuals. It's a lifelong process, and certainly beginning in childhood early on is extremely important.
Да, и имаме коментар в чата, който всъщност обобщава това, че наистина има нужда от устойчивост и продължителност в усилията през целия живот, за да не се загуби това, което е постигнато в даден етап в развитието на човек. Ами, сега, понеже имаше няколко човека, които се включиха по-късно, ако имате интерес да получите бъдещи имейли от нас, свързани с поредицата от събития и статии, които ще споделяме, може да напишете имейлите си в чата.